Good morning, and thanks so much for joining our conversation today on the ways we're pivoting to meet the community's food needs during these extraordinary times. I'm Elizabeth Cooper with Second Harvest Heartland, and I'll be facilitating this morning's call. Note that everyone except our speakers will be muted during the call, but we welcome your questions. They're actually why we're here. So please post questions in the Zoom chat on Facebook or email me at ecooper@2harvest.org. As is usually the case, we have a few questions already this morning, so please be sure to post yours early so that we can work hard to get to them. Now I'm going to pass the mic to Allison O'Toole, CEO of Second Harvest Heartland. Allison?
Elizabeth, yes, Allison O'Toole, the very proud CEO of Second Harvest Heartland. Thank you all for joining us this morning. People in our communities are hungry, while truckloads of food intended to feed them are arriving just miles from their doorsteps. Since March, Second Harvest Heartland has delivered over 70 million pounds of food in entirely new ways. We've kept people safe, socially distanced, and fed by organizing emergency grocery pop-ups, outdoors, and truck-to-trunk drive-thrus. Now, the progression of the pandemic demands that we flex again as increasing numbers of people are sick at home, find themselves without transportation, or are working around the clock in frontline jobs that have become more and more demanding. Two-door meal drop-offs are a critical new front in our fight to keep the community well. If you don't have a car, it's a real hardship to get the groceries you need home from the food shelf or one of our grocery pop-ups. In fact, it's closer to impossible. We pack emergency grocery boxes full so folks have all the meals they need for days and weeks. We fill them with staples in heavy cans and with produce that can add to the weight. Imagine walking for miles with that needed food or trying to carry it home on a bus. We can do better. And even in the best of times, it's a challenge to be sick at home, especially when you're responsible for little ones or elders in your household. COVID makes these scenarios all the more grim, and the arrival of fresh, ready-to-eat meals makes a critical difference. We hear from kids caring for younger siblings while parents are sick. We hear from elderly neighbors stuck at home battling COVID. And we hear about frontline workers who are struggling to make ends meet in these tough times and are working several jobs to ease their family's way. They find themselves short on funds and cooking time. They all need proper nutrition to win the fight, and it helps us all to ensure all of our neighbors who need to stay home and recover can do so. Our hardworking partners have helped us deliver nearly 135,000 meals to homebound community members and frontline workers in the last 2 months. The demand is only expected to grow, but it is work we simply must do. The alternative is unthinkable. It takes an immeasurable passion, hard-earned logistics expertise, and a whole lot of community-driven people power to get food into these neighbors' households. And we stand on the shoulders and follow the lead of many community partners in undertaking this work. A grant from Wells Fargo has allowed us to work with our amazing North Minneapolis partner organizations to serve hundreds of families each week. I'm honored to be joined by Sondra Samuels, President and CEO of Northside Achievement Zone. Sondra, great to see you. And we have the amazing Stella Whitney-West, CEO of NorthPoint Health and Wellness on deck. Welcome, Stella. And Antwayn Hunter. Welcome, Antwayn. He is the tireless Breaking Bread Logistics Manager at Appetite for Change. It's an honor to be with all of you. We rely on the deep community connections, smarts, and support these partners bring, and I am so thrilled to hear what they have to share with us today. So Sondra, I'd love you to kick it off. How has NAS been responding to the crisis caused by COVID and the other crises in our community, and what's on your mind?
Yeah, thank you, Allison. Hi. And I want to first give a thank you shout out to Wells Fargo. They have really been leaning in. We need our philanthropic partners. So thank you. I saw Patty from Wells Fargo, and Allison and Stella and Antwayn. Thank you so much for your partnership. it is, we need each other during this time, and you all leaning in and us coming together. That's where the power is. And I'm looking forward to not going back to normal. Right. We really have to, we have the power to make our city over again. And we know that the depth of the crisis around food is really the tip of the iceberg, right? Underneath the iceberg are all of the disparities around jobs and income and housing and C-19 and the egregious murder of George Floyd and the rioting and looting that followed, all of that together, and the argument about defunding and dismantling the police all have come together to create this perfect storm. And so our families are in need of housing, and we're working with, so Allison, your question was, what are we doing? We are working with over 30 partners in housing, career, health, largely mental health right now, early childhood, K through 12, after school, summer, colleges, and we're doing a whole host of parenting education classes. All of our partners come together. We meet regularly and talk about the crises that we're in right now. And what has come up for us as never before has been the food insecurity, right? Because of everything that we just named. So we were doing cash assistance, $200, $100 gift cards to our families, rental assistance. We've done about 200 grand in assisting our families, Chromebooks. And the last thing for us to do was around the food. Like in fact, we have about 800 or more families who are in our network of support. And around of about 400 or so, or 150 are getting the food right now. When Wilder Research surveyed them, 60% said, yes, we are food insecure. My children, I am not eating in the way we used to. And 81% said that it was new since C-19 and all of the tragedies. And so partnering with you all on delivering groceries and cooked meals, which our families love, has been a real game changer. And we just look forward to, as we continue down this path, to meet the needs right now, right, of our families and community, so that in years to come, we don't need to do this. And that's in programming and policies that we have to change.
That's awesome. Thank you, Sondra. And we are just feel so fortunate to be partnering with you around new work for both of us. And you have our commitment that we're going to stay with you and everyone else through this and beyond, because it's not going back to normal.
No, thanks, Allison.
I like that. We're not going back to normal. So thank you for sharing that. And I want to highlight that with the help of NAS and our friends at NorthPoint, we've delivered nearly 110,000 pounds of food to over 1,000 families in North Minneapolis, including 150 families enrolled by NAS, as you said, wow. Sondra. It's amazing. And that doesn't even include the thousands of pounds of nutritious produce that the NorthPoint team has made available at the free Fresh Food Fridays. It's hard to say, Stella.
Right.
Contributions, and the impact of your work is so inspiring. And Stella, I'd love to hear your thoughts about how these types of partnerships support your team's work over at NorthPoint.
Thank you, Allison. Thank you, Sondra, and thank you, Antwayn. It is truly an honor and a blessing to be here with all of you. I think talking about food and food insecurity is one of the things that is really heart-wrenching, that in this day and age, in this country, that we have families that don't know where their next meal is coming from, and families that don't have the wherewithal to even get to places like NorthPoint, where we do have a food shelf because of transportation, and families that are taking public transportation, having to juggle even carrying the food on public transportation. So we have to ask ourselves, definitely we are not looking to going back to whatever we want to call as a normal, but really defining what the new normal is. And the new normal is that we work together as partners to make sure that, that we don't have to have, this type of partnership to just get basic food to people. So first of all, NorthPoint Health and Wellness Center, we have been in this community for 52 years. We tell people that we came out of the rebellion. So when people look at the rebellion that has happened behind the murder of George Floyd, we also look to see that what happens after that, and so for NorthPoint, also known as Pilot City, in 1967, 68, we came about as a result of the rebellion that happened on Plymouth Avenue, where the community said that they wanted to have a place where there was employment, where there was health care, where there was access to food. And so that's how we came about. So we do have healthcare. So we have medical, dental. We also have mental health. We are also in the public schools as well. And then we had to shift, as others did, because of COVID-19, which meant that we went to telehealth. And because the schools were let out in March, we were able to continue to provide that connection to the students with our behavioral health staff because of telehealth, because they were able to connect with them. And it's extremely important in this time where a lot of our students are doing online. It's difficult for them, it's difficult for their parents. So we want to make sure that we're able to continue that. I think I always marvel at the, I just say the flexibility and also the innovation of partnership, so that we were able to partner to deliver food as a part of our Fresh Food Fridays, or free Fresh Food Fridays. To be able to deliver, and I also shout out to Wells Fargo, not only fresh produce, but also dairy and meat, because Wells Fargo provided the refrigerated truck. We saw, which I was just amazed, seniors who came in through Metro Mobility. And initially, Metro Mobility was just dropping them off, and then you have to call for them to be picked up. And our staff said, no, 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 no. They told the Metro drivers, do not drop them off. Stay in the van. We will deliver the food, and then you can just turn around and take them back home. And so right on the fly, they were making changes to make sure that our community, that our seniors were taken care of. I think that as we look to the winter, and as we look to the fact that this COVID-19 is not going to go away, it is going to be with us. We have to continue to practice wearing our mask, practicing washing our hands, practicing using hand sanitizer. We do that and in our clinic, in our food shelf. We do that and encourage that also within the community, because that is one way that we know that we will be able to defeat this virus. Any type of vaccine is a ways down. We also, when we talk about social determinants of health, we see food. Food is medicine. Food contributes to health. We also tell our people about the political determinants of health, that it is important. If you didn't know before, you certainly know now that who you vote for, who is in office, determines your access to health care. It is also who is going to determine your access to food. So we want people to keep that in mind. And then just to say overall that our community is resilient. We have seen many of the donors who donate to our food shelf are former food shelf recipients. So people are always wanting to give back. And so we're very grateful for that. So thank you, Allison.
Yeah, thank you, Stella. And it's truly amazing work that you and your team are undertaking, and the breadth of it is always impressive. So thank you. Thank you. Thank you. And now, in addition to making fresh food like protein, dairy, and produce available through home delivery, our partners with us today have also delivered nearly 20,000 prepared meals directly to NAS families through our Minnesota Central Kitchen initiative. These meals are prepared by our partners at Appetite for Change, and to date, they have made over 136,000 meals for their Northside namers. I know. And so, Antwayn, awesome job. I mean, I know I always say you're cooking with gas. And I hope you are so proud of your team. We are so proud of your team and so proud to partner. I'd love to hear more about how you're continuing to innovate and what else is on your mind.
Thank you for having me. It's an honor to be amongst you guys. When everything first happened, we, just like everyone else, we didn't know what was going to happen or what the future looked like as far as the business went. We have 2 restaurants now. We have a catering and events department as well, and we also, those departments are staffed. So once this happened, all those folks don't have jobs anymore, and then we're also trying to figure out how we were going to transition as an organization, but still be able to, contribute to the community. The one thing that I learned right off the bat was that there's a lot of people struggling, like a lot of people, specifically on the north side. I live on the north side, and I didn't realize how bad it was. Food being probably the most basic thing, the people were struggling with. It blew my mind. We were fortunately able to reorganize and pivot the organization to go towards food distribution instead of the restaurants and the catering. It started off where we had a few partners, and we were delivering to some distribution points, and then probably one of the craziest things for me was to deliver food directly to people's homes. To see folks show up to the door happy to see you is probably one of the most fruitful things I've ever done in my life. We were also able to bring back staff. Some folks had jobs changed a little bit. I was initially running restaurants and catering, and now I got to figure out how to get all this food throughout the north side. Our sales folks went from doing, managing sales accounts to packaging food, to something that completely different than what their normal job is. But since then, we have been able to build our partnerships, build distribution points, and honestly build this program to the point where it's something we can continue even once we go back to whatever normal is. But we're still trying to get our programs going. We have our youth working offline or online and helping with the gardens and stuff. Our gardens are building back up, and we've got a couple greenhouses being built. And then as far as like the MCK stuff and the donated meals, we're working really hard to get that as large as we can and to keep that capacity growing.
Yeah, that's awesome, Antwayn. Thank you. And we are working just as hard on our end to keep it going too, because you're doing so well. So thank you. Thank you. And the truth is, we're, I think, just all getting started. And I hate to say that 7.5 months into all of these compounding crises we have, but we are just getting started, and we can't let up on the hunger fight now. As hungry families head into the holiday season and the winter, and desperation truly set in. So every day, yeah.
Oh, no, go ahead, Allison. Finish up.
Okay, I just have a couple more sentences, and then I think let it rip with me and we'll take some questions. Every day in every community across the state, families are watering down milk and moms are skipping meals so their kids can have a little more. The good news is that we live in the heartland where there's food and generosity to spare. And I think really hard work as evidenced on this call. So I know you all join me in our effort to build a better 2021. When generosity wins over suffering, let's ensure every table is full, even as we enter our 7th month of living with COVID. So Sondra, if you have something to add to that, go for it. And I know Elizabeth, we've got some questions that we'll take to at some point.
Yeah, I just wanted to punctuate and make sure everybody knew that, so yep, C-19, rioting, looting, our Cub in North Minneapolis here on Broadway closed down. It has reopened. When it was down, it was definitely a hardship, but it's reopened to about half its size. And so most of the fresh vegetables and fruit that used to be there are no longer. It's more like a farmer's market now. So no refrigerated produce, right? And that is part of what all bodies need to be healthy. But one of the things, and Antwayn and Stella both know, in addition to families, and Stella talked about this, not having transportation. Again, we're getting into policy now, and what's happened in terms of one of the reasons the North Side is hit so disproportionately is because we have been so neglected so disproportionately. But it's not just transportation or people having children at home. And so getting out is a challenge. But right now, people are afraid to leave their house because of the egregious levels of violence. My families talk about it all the time. Our children are in trauma. And I know this is all over the city, but I know right here, we had a shootout on my block. I've been living in North Minneapolis for 23 years. Yesterday, if we were on this call at 3 o'clock, you would have heard 5 gunshots, then you would have heard 12, then you would have heard that somebody got shot down the street, across the street from Cub parking lot, by the way, where another neighbor who was at Cub got shot, his car, because there was a shooting at Merwin's liquor store that's right across the street. And so I can't stress enough the level of partnership that we need with nonprofits, with the philanthropic community, with our city officials, our state officials, that we have some policy issues that have put us in the place that we are right now. And I'm hoping that always stays in the front while we programmatically make sure that we're addressing the needs right now. And hunger is chief among them for a myriad of reasons.
Yep. We're with you, Sondra.
Absolutely. Panelists, anything to add before we dig into questions?
Well, one of the things that I want to add is also, so NorthPoint is connected in partnership with Hennepin County. So also piggybacking on what Sondra has said. And so I was so proud when the county board passed a resolution declaring racism as a public health crisis. And so why that is so important is that when we talk about communities like North Minneapolis, we also have to talk about the impact of racism has had on a community, to be neglected on a community. When you talk about policies that are made that disenfranchise a group of people based on their race, ethnicity, and that is what has happened to North Minneapolis, so that it gets neglected. When we look at the violence that is occurring, certainly the criminal justice system has a lot to do about that. It also has a lot to do about the families that we are talking about as well. When young people feel a sense of hopelessness, feel a sense of powerlessness, then they are easily lured into those kinds of false, and I say weapons of power. And so we also have to look at that as well. There are so many issues that we confront on a regular basis, but they are also connected to some basic roots and
Right.
basic causes.
Right.
But we also have to understand about who makes policy and understand about that the power that people have about electing and voting. I'm saying that again. So it is important that you do not ever neglect your power through your vote. So you can make a difference. You can determine who makes those policies that puts you and your family at risk.
Amazing. Thanks, everyone. I'm getting so caught up in listening that I'm forgetting about our questioners, but here they are. So Jana in North St. Paul asked, what of the innovations you shared today will you decide to make permanent? Sondra, maybe we'll start with you and then open this one up to the whole panel.
Well, again, hoping that there's not this level of need, like that's what we're working towards, as we go forward. But as long as there is, for me, this partnership and meeting the needs of our families right now. Like, right, we're because right now is what people are hungry. Right now, people smile when Antwayn comes to the door because they're so grateful for the partnership, right, and support. And so for me, that would be, as far as I can see, that we're going to continue to meet the need as long as there is one.
Absolutely.
I'd say as far as the food distribution, we will definitely be keeping it as a permanent program. If anything, we've already expanded outside of North Minneapolis. So if anything, we're just going to keep reaching as far as we can.
Absolutely. Stella.
And I agree with my partners that we would definitely continue the partnership and growing the partnership. I also think adding the component of fresh produce. I was so happy to hear Antwayn talk about the fact that that they are building greenhouses because we have to make sure that the type of food that we are distributing to our families is healthy food, food that is going to fuel their bodies and their minds.
Now, Elizabeth, maybe I can just say at a high level, and to reiterate, Sondra, what you said, we're not going back to normal in any way. And even when you think narrowly about how we just do our core business, we're thinking through permanent changes. And, COVID we're not out of the woods by any means. And so some of the operational changes we've made will stick, and we'll think through new ones for the winter. But Minnesota Central Kitchen is a prime example of innovation that is working, and we continue to learn from partners and partnerships and refine it as we go, but we're really proud of that program, and we're all in.
And I want to add to Allison and everybody, we have, of the 30 or 40 partners that we have there, so we share some families, right? Hundreds of families. But all of our partners have their own families they're serving as well. And they've asked if they could be part of this partnership. And so, we'll be looking at, in the future, how we expand.
Awesome.
Big things to come, everybody. So we've got 3 questioners asking how they can help. Lorraine, Sarah, Joanne, all want to know how they can help each of the organizations on the panel. So Stella, go ahead, Allison.
Elizabeth, I was just going to say, let's put links to everyone's organization in there. I will make the pitch for everyone because I'm shameless, but every organization needs resources. That is the financial resources. That is the most efficient way to help right now. I assume some need some volunteers, but I'm going to go back to what Stella was saying. It is a couple of things about using your voice and your own power. Part of the reason why we have these conversations is to take the stigma away from asking for help,
Right.
and make it okay to ask for help. I always think that shows you trust your community. And so these conversations help us make it okay to ask for help, and then use your voice through your vote to vote and connect all the policies that this community needs to be healthy with your vote. I think about SNAP. I think about healthcare. I think about a lot of things when I vote. And I hope everyone is doing that. And I know, Stella, you were carrying that torch a minute ago. So I'll pass it back to you.
Well, and I also think, Allison, the comment that you made about making it okay to reach out for help. One of the things that we saw was a significant amount of families that were coming to our food shelf, and it was the first time. And some of them were a little nervous about the whole experience. So we, and I know all of our partners do the same thing. You treat people with respect and dignity. Let them know that as a community, we care and take care of each other. And that when they are in a position that they can always give back. So that is very meaningful. And we always want to make sure that people know that as a family, as a community, that we take care of each other. And nobody has to be feel ashamed about reaching out for help.
Absolutely.
And I would say, yeah, I was gonna say, I would say, to punctuating what Allison said, always supporting us financially, because then we can do what we know our families need, in terms of, I mentioned some of the things that we're doing in this emergency phase. And more importantly, as we continue to talk about votes and voice, people in North Minneapolis are food insecure for a reason. And so I would ask that everybody really understand what it means to be anti-racist. And it's not enough to just say you're not racist and do nothing. Injustices that cause a whole community of people to about jobs, that's about housing, that's about health, that's about safety. I sent an email to my staff today, and I posted every city council member's email address, the mayor and the police chief, and said, if you, they shouldn't sleep. If you're worried, they should be worried. And to use our voice together to change the situation for too many people simply because of the color of our skin.
Thank you, Sondra.
Yeah.
Antwayn, what's on the wish list for Appetite for Change? How can Lorraine and Sarah and Joanne get in line to help?
It's, pretty much the same. Go online and donate. But we have some tools on our website to let you know when volunteer opportunities do come up, how you can get involved. But just to piggyback off what Sondra and Stella said, vote. We have to vote. This is by far the most important election in modern times. I was like, if you're not voting and trying to do something to make a change, I don't know what you're doing.
Mm-hmm. Mm-hmm.
So we are already out of time together, but I can't think of a better idea to wrap things up on. Do vote, folks, and the conversation continues. We look forward to having you back. There's so much more to say about this work. So thank you so much, everybody. Have a wonderful day.
Thank you. Thank you,
Bye.
everybody.
See you soon.
Right.